Good evening, everyone. Today, we will delve into the fascinating world of biochemistry as we explore the intricacies of several metabolic disorders related to phenylalanine and tyrosine metabolism. Specifically, our focus will be on phenylalanine hydroxylase deficiency, BH4 deficiency, phenylketonuria, PKU, Tyrosinemia, phenylalanine-derived neurotransmitters, tyrosine hydroxylase deficiency, dihydropteridine reductase deficiency, melanin synthesis, Alcaptainuria, Catecholamine metabolism, the phenylalanine loading test, and nutritional interventions in PKU management. Let us begin our journey by understanding the key aspects of each of these topics, starting with phenylalanine hydroxylase deficiency. Phenylalanine hydroxylase deficiency, also known as phenylketonuria, PKU, is a rare genetic disorder characterized by the impaired conversion of phenylalanine to tyrosine. This enzymatic defect occurs due to a malfunctioning phenylalanine hydroxylase enzyme. As a result, phenylalanine accumulates to toxic levels within the body, leading to various symptoms such as intellectual disability, behavioral problems, and skin disorders. The diagnosis of phenylalanine hydroxylase deficiency is typically confirmed through newborn screening tests that measure phenylalanine levels in blood. BH4 deficiency is a metabolic disorder that affects the synthesis and recycling of tetrahydrobiopterin, BH4, an essential cofactor for several enzymes involved in neurotransmitter synthesis. Inadequate levels of BH4 can lead to disturbances in phenylalanine and tyrosine metabolism, resulting in conditions such as hyperphenylalaninnemia and neurotransmitter imbalances. BH4 deficiency can be diagnosed through genetic testing and biochemical analysis of BH4 metabolites in the urine and blood. Phenylketonuria, PKU, is an autosomal recessive disorder characterized by the inability to metabolize phenylalanine properly. Individuals with PKU lack the enzyme phenylalanine hydroxylase, which is crucial for converting phenylalanine to tyrosine. Without this enzyme, phenylalanine builds up in the blood and tissues, leading to neurological and cognitive impairments if left untreated. Treatment for PKU involves a strict low phenylalanine diet and lifelong monitoring of blood phenylalanine levels. Pyrocinemia refers to a group of inherited metabolic disorders that disrupt the normal breakdown of tyrosine, an amino acid derived from phenylalanine. There are 3 types of tyrosinemia, each caused by the deficiency of a specific enzyme involved in tyrosine metabolism. Pyrocinemia can cause liver and kidney dysfunction, neurological problems, and an increased risk of liver cancer. Management strategies include dietary interventions, medication, and in severe cases, liver transplantation. Phenylalanine serves as a precursor for various neurotransmitters, including dopamine, norepinephrine, and epinephrine. Neurotransmitters play critical roles in communication between nerve cells and are involved in various physiological processes, such as mood regulation, motor control, and stress response. Dysregulation of phenylalanine-derived neurotransmitters can lead to neurological disorders like Parkinson's disease, depression, and attention deficit/hyperactivity disorder, ADHD. Tyrosine hydroxylase deficiency is a rare genetic disorder characterized by the impaired synthesis of the enzyme tyrosine hydroxylase, which is essential for converting tyrosine to dopamine. Dopamine is a key neurotransmitter involved in movement, reward, and motivation. Deficiency of tyrosine hydroxylase leads to a reduction in dopamine levels, resulting in movement disorders such as Parkinsonism and dystonia. Diagnosis is based on clinical symptoms, genetic testing, and biochemical analysis. Dihydropteridine reductase deficiency is a rare autosomal recessive disorder that impairs the recycling of tetrahydrobiopterin, BH4, an essential cofactor for phenylalanine and tyrosine hydroxylase enzymes. This deficiency disrupts the synthesis of neurotransmitters dopamine, norepinephrine, and serotonin, leading to neurological symptoms such as intellectual disability, seizures, and movement disorders. Diagnostic methods include genetic testing, measurement of BH4 metabolites, and evaluation of neurotransmitter levels in cerebrospinal fluid. Tyrosine plays a vital role in the synthesis of melanin, the pigment responsible for the coloration of hair, skin, and eyes. Enzymes involved in melanin synthesis convert tyrosine into melanin precursors, which are further processed to produce different forms of melanin. Defects in these enzymes can lead to conditions like albinism, where individuals lack melanin production or have reduced melanin levels. Diagnosis is based on clinical features, genetic testing, and examination of melanin content in the hair, skin, and eyes. Alcaptainuria is an inherited metabolic disorder caused by a deficiency of the enzyme homogenizate 1,2-dioxygenase, which is involved in the breakdown of phenylalanine and tyrosine. This deficiency leads to the accumulation of homogenizing acid, causing the urine to turn dark upon exposure to air. Besides urine discoloration, Alcaptainuria can result in joint and cartilage degeneration, cardiovascular complications, and kidney stones. Diagnosis is confirmed by analyzing urine for the presence of homogenitizic acid. Catecholamines, including dopamine, norepinephrine, and epinephrine, are important neurotransmitters and hormones involved in various physiological processes like the stress response, blood pressure regulation, and mood control. Their synthesis and breakdown are tightly regulated, involving enzymes such as tyrosine hydroxylase, dopamine beta-hydroxylase, and monoamine oxidase. Dysregulation in catecholamine metabolism can lead to conditions like pheochromocytoma, attention deficit/hyperactivity disorder, ADHD, and certain mood disorders. The phenylalanine loading test is a clinical diagnostic tool used to assess the functionality of the phenylalanine hydroxylase enzyme. During this test, a controlled amount of phenylalanine is administered orally, and blood phenylalanine levels are monitored at specific intervals. This test helps in distinguishing between different types of phenylalanine hydroxylase deficiency, determining response to treatment, and evaluating dietary management approaches. Nutritional interventions play a crucial role in managing PKU. The mainstay of treatment involves adhering to a protein-restricted diet low in phenylalanine. Patients with PKU consume specialized medical formulas that provide essential amino acids while limiting phenylalanine intake. Regular monitoring of blood phenylalanine levels is vital to optimize dietary modifications and prevent the accumulation of toxic phenylalanine levels. In some cases, individuals with PKU may require medical foods or medications to support the metabolism of phenylalanine and tyrosine. In conclusion, the intricate world of phenylalanine and tyrosine metabolism holds significant importance in understanding various metabolic disorders. From phenylalanine hydroxylase deficiency to nutritional interventions in PKU management, a comprehensive understanding of these topics is fundamental for medical professionals involved in diagnosis, treatment, and research in this field. By expanding our knowledge in this area, we can strive towards better management and improved quality of life for individuals affected by these disorders. Thank you for your attention, and I hope this detailed script has provided valuable insights into the biochemistry of phenylalanine and tyrosine metabolism.